Indiana. It is the voice of Indiana County. It's WCCS 101.1 FM, AM 1160, and WCCSradio.com. June is Men's Health Month, so who better to talk about men's health than a doc who specializes just in that topic, urologist and a guy at the Indiana Regional Medical Center. Dr. Berjesh Sharda is with us this morning, and we're happy to have him here as we talk about what is a neglected thing. I saw Dr. Sharda yesterday, an item that said that I think it's 56% of guys will just, if they have a health concern, they'll just hope that it passes. And they won't go see a doctor for it.
That's so true. That's so true. You know, it's almost about 60% if you look at the data from our own community. So only 60% of the men will, ever go to a doc just to have a regular follow-up, regular checkup. And, out of those 60%, the 20%, funnily, they go so that their partner is not no more nagging them about going to a doctor. That's a fun fact, but that's true. So, yeah. So being, on men's health, we have many issues, especially the people that I see in my office.
Yeah.
50 years old or, older men with issues with prostate cancer, erectile dysfunction, urinary retention. So, there's a plethora of issues that we have in the community, but I think we need to make men more aware that they need to come and see us more often.
Yeah, absolutely. Our conversation with Dr. Sharda brought to you by Marcus & Mack, voted best personal injury law firm in the Best of Indiana County contest. Marcus & Mack, a law firm representing injured people. So when it comes to urology, and specifically, we think, okay, urology, that's, I go get my prostate checked and then I'm fine, because that's all urology is about. It's not all just
that's true. But, it makes a big part of what we do. Mm-hmm. But there are concerns about, apart from prostate cancer also. As I said, erectile dysfunction, urinary retention issues, blood in the urine, pain due to stones. There is plethora of things, recurrent infections in women, urinary incontinence, which is, very much less talked about. It's less frequent in men, but it's still there. So, I see people kind of self-neglect them, present to us in their 70s or 80s with issues which could have easily been treated, back when they were in 50s or 60s, just with probably a pill a day.
Yeah, that live with it syndrome.
Yeah, that's true. Yeah.
Yeah. So I'm sure that there are things that you see more commonly than others.
That's true.
What are some of the more common urology issues?
So the number one thing that I see today these days is the prostate issues. Whether it's related to urine retention or the prostate cancer. When I came in, we were not we were having very limited options to treat prostate cancer here in the community. Mm-hmm. But we have started treating now with, robotic urology. We are offering robotic prostatectomies. Plus, we have also started offering focal therapy this year. So last year, I had few people who were traveling as far as down to Florida to get it done.
Wow.
Yeah. So, but now we have, those things here that we can, help people.
Okay. So what is that term again?
It's called a focal therapy for the prostate. It's like a localized treatment for prostate cancer. Mm-hmm. And we have started, this year. Yeah.
What happens with that?
So it's like a minimally invasive treatment, either if you think of prostate cancer, many people will think of you need to have either surgery or you need to have a radiation therapy or chemotherapy, something like that. Mm-hmm. But focal therapy is when we just go inside the prostate gland and try to burn just the cancer part of the prostate, not the entire prostate. Uh-huh. So it's like, it's not a whole gland therapy. It's just focusing on that particular cancer segment.
Yeah.
So, and that's something which is going to be, part of the standard of care in coming years.
That's a really big thing.
It's a good thing. It's all about quality of life at the end of the day. So that's what it is about, have a good outcome plus, maintain your quality of life without any side effects.
Now, it is men's health, and you are a urologist, and we talk about men's health in those terms. But it's not just men who need to see a urologist.
That's true. A lot of women, as I said, come to us for chronic UTIs, incontinence, kidney stones, or even, cancers, kidney cancer also. But now we offer, all type of robotic kidney cancer surgery. Yeah. and procedures for urinary incontinence also.
We think of visiting our doctor on a regular basis, and primarily we think of the primary care physician, and we should do that once a year.
Right,
And that's the way, that seems to be the standard that most people who are health conscious would go about it.
True.
What about with urology? Should there be regular scheduled visits with a urologist?
Well, there are, some issues for which you should come to the urologist. I mean, once a year or maybe twice a year, just for the PSA checks, your digital rectal examinations. And, as I said, if you're a man above the age of 50, 55 who's having any sort of urinary issues, I think once a year follow-up is at minimum.
Yeah. And screenings then generally they're done in the office, they're done in the lab. How are screenings?
So part of it's in the office, and part of it is a blood test, which is a PSA for prostate cancer. But I would also strongly suggest take this opportunity for the younger men in their adolescent years to do like a testicular self-exam once a month. That's very important. So we can pick up early stage tumors many a times, and they're totally curable at that time.
Younger men, older men,
Yep.
I'm sure that there are different reasons for going to see a urologist for younger men
Yep.
than there are for older guys.
Absolutely. Younger men mostly come with, sometimes sexually treated sexual tract infections. Sometimes they come with, testicular pain. Sometimes they come with kidney stones. So it's altogether a different plethora of symptoms and diseases.
Well, you recently started performing those robotic surgeries that you were talking about a couple of moments ago. Say it again. Focal.
Yeah, so that's different. Robotic surgeries are
robotics
different.
are different.
Yeah, and focal is different. Yeah, robotic is more of a tool that we treat our prostate cancer patients, bladder cancer patients, or kidney cancer patients. And focal is more for just prostate. There is some role in the kidney cancer patients, but mostly it's for the prostate.
Yeah.
Yeah.
So the field here in Indiana at IRMC is expanding.
It is expanding, and I think that's how it should be, because I think we were kind of lagging behind few years, but we are hoping and trying our best to catch up now.
Yeah. We're talking today to Dr. Berjesh Sharda, who's been here for a year.
18 months probably, I would say.
Really?
Yeah, it's been
that
close to
long.
that.
Yeah. Well, it's great that you've become established now within the community.
Well, I'm grateful to all my patients who showed their trust. That's number one thing for me.
Yeah. So we talk with you about urology, but it is Men's Health Month. There are other issues that guys should be aware of,
Right.
And doing to preserve their health, right?
Right.
What are some of those?
Well, they don't just pertain to urology as such, but they just pertain to, individual health also. So, eating right, exercising, getting good amount of sleep, getting hydrated, and getting, annual examinations. That forms a baseline that, if you have something wrong, you can pick it up and treat it.
Yeah.
And the one more important thing not related to urology per se is generalized stress. In the age of social media, we have a lot of stresses. We are always kind of comparing ourselves to others. That's also something that we need to work on.
That's interesting that you say that, because sometimes, you get into those situations where, you've got your daily stresses anyway.
That's true.
And now you get involved in something like that. And what happens from it is you end up neglecting areas of your life while you're so hyper-focused on something like that.
True.
That those other areas, we don't even, it's like the weeds growing in the back. We don't notice the weeds growing in our lives.
Absolutely.
And when they start to grow, they could become a problem pretty quickly.
I totally agree with that.
Yeah.
That's true.
Yeah. All right. So let's talk a little bit again about urology specifically, and younger guys and older guys. I'm sure there are age ranges. You mentioned 50 to 55.
Right.
That people would come to see a urologist.
Yeah.
Younger guys who come to see a urologist, you mentioned some of the conditions that they would be involved in as well. Fertility issues in younger men. Are those something that a urologist would be concerned about?
Yes. There are many times we see men who have those fertility issues, and they are, as I said, mostly related to your lifestyle stressors. Sometimes they have medical conditions like, varicocele or any previous injuries to the testis or any hormonal issues that can cause, secondary infertility. And, we certainly can treat them. So it's fertility is mostly, urology is a part of it. It's a multi-specialty thing, but, when it comes to specifically men's fertility, we can certainly help there.
I also, because you see articles and you see sort of things on the side when you're reading something on the internet. I'm fascinated by the number of different home remedies, different dietary recommendations for this condition or that condition.
Right.
Are there dietary things that we could be doing, for instance, to help our prostate?
There was a study. There were few studies which said that certain type of foods are preventing of prostate cancer, but by and large, data is not much supportive of that. I mean, a regular healthy diet, there's nothing specific that you eat that can help prevent the prostate cancer at this point. But there's a lot of research kind of going on.
Yeah.
So hopefully something will show up.
But statistically, the thing to do to ensure good prostate health is to make sure you're getting that regular visit.
That's true. Plus, you have to ejaculate often. That's also something which is protective.
That's a part of it as well.
Yeah, that's true. Yeah.
So all of those things come together to put together a whole health picture.
Absolutely. Yeah.
Guys.
Yeah.
Yeah, terrific. All right. So folks want to get involved with your office and visit that urologist and get those tests done, those screenings and everything.
Absolutely.
What should they do?
They should just call our office at 1265 Wayne Avenue, and we'll be there to help them.
Beautiful.
Yeah.
It is Men's Health Month, and we want all guys to be healthy because they've got families too, and Dr. Sharda is certainly there to help you in that respect. Thanks for the visit today. Appreciate it.
Thanks for having me here. It was an honor.
It is the voice of Indiana County. It's WCCS 101.1 FM, AM 1160, and WCCSradio.com. Just about 24 minutes after 8 o'clock. Well, Dr. Sharda is concerned with your health. So is the folks with the Health Beat, and our health cycle is next. We've got Health Beat with Jacqueline Carl this morning, and making the house call, it is Lisa Brady.
A new study suggests swapping out sitting for light activity can help you live longer. A recent study by